Well, for our perspective guest today, we're going to talk now to Deputy Director Policy, Advocacy and Knowledge of UNAIDS, Christine Stegling, who joins us now from London. Thanks very much for being with us on the programme today. So a huge funding cut we heard there in that report. I mean, in your words, what has that actually meant then for what services you're able to offer and therefore, of course, those people who need those services?
Hey, good morning. Thanks for having me. You see, what we're saying is this enormous disruption that we experienced this year in the AIDS response is really unprecedented. You have to remember that, yes, we had declining funding for many years, but the United States government provided over 70% of all global HIV funding. So the disruption at the beginning of the year and the slight confusion about what the United States might come back to fund actually has caused us a situation where, as we say, the ecosystem that we have relied on for so many years, that is a careful combination of government services, but also importantly, services in the community, is what has really been impacted by that. And so what we have seen, treatment services are interrupted, but what we are also seeing is that prevention services, so making sure that we don't have new infections for HIV, is where we have seen the greatest disruption over the last few months, and also where we are seeing it most difficult to actually try to resume those services without new funding.
Infections have dropped, haven't they, by around 60% since the peak in the late 1990s. Why can we not forget about HIV and AIDS now? I mean, if it's dropped by that much, will it not just continue dropping?
Well, it's a lot of work for it to drop. So what we need to ensure is that people are aware of their risk, and that affords programs in the community, in schools, in places where people come to educate them about what risk they might be facing with HIV. So we need programs, we need awareness programs. We see in some countries, Fiji is a good example recently, where we're seeing an increase by over 3,000% of new infections from a low baseline, but at a moment where there wasn't enough attention being paid, where there was a complex set of circumstances what led to that. But epidemics can outbreak again if we are not supporting services regularly and consistently.
We're going to show some images now that I know you've shot in Tajikistan, Eswatini. It's often, isn't it, those marginalised communities which have been most hit.
Yes, absolutely. Where we are seeing a resurgence of infections is when communities are not being made part of programs. So we often see it in what we call key population groups. So the LGBTI community, sex workers, injecting drug users, but in Africa, also adolescent girls and young women. When we don't reach them with the right programs and when we don't serve them with the right programs, it is very easy for epidemics to resurge. And I think what we are experiencing right now is that it's exactly those communities where we're seeing a resurgence of new infections. And so what we really need to do in the next few weeks, months, is to think about how do we ensure that these communities are reached, that we have programs that address them, and that where governments themselves are not able to support those kinds of programs, we need to find international help to do that. And even though we have seen that governments are stepping forward, often it is not for those groups that are most marginalized. Those are not the groups that are reached by governments themselves. And that's where we need international solidarity, where we need international help.
And of course, it's not just in rural areas or countries where it might be a little bit more difficult, is it? I mean, we saw some figures just a few moments ago, in fact, from here in France, showing the number of cases just in and around the Paris region. It's in more urban areas as well, yeah?
Absolutely. I think we always need to remember that the people that are most at the margins of society, maybe because they're migrants, maybe because of race, maybe because of gender, maybe because of their identity or their profession. If these communities are not reached, no matter where you are, if you don't have targeted programs for them, that is when we see epidemics coming back or infection rates going up. And that's why it's so important that we continuously, even when we're successful, monitor what's happening, ensure that we have the right data so that we can target our programs exactly at those communities. And that is what we're missing at the moment. We're missing testing in the right populations. We're missing the right resources to continue having the right data to inform our programs. And that's what's all at risk right now. That's why we're saying we're at a crossroads. We need to decide. We know what to do. We have the right tools. We even have new tools to be successful in our work. But if we don't have the political will, and if we don't have donor governments, but also most affected countries apply the knowledge that we have, we are very likely to go back in time and see a situation that we haven't seen for 2 decades, where we see a rise in new infections, but also a rise in death.
Yeah, let's talk about that at the end. I mean, 3.3 million new HIV infections. That's your warning that if the current situation stays as it is, more cases over the next 5 years. I mean, where can we go about changing that, assuming, of course, the situation in the US doesn't change? How can you combat that and stop that 3.3 million increase?
Look, we have had a little bit of good news in the last couple of weeks, right? We have seen that the United States government has made a commitment to fund the Global Fund to fight TB, HIV, and malaria. That's a good sign, at a reduced level, but still at a high level. We have seen some donor governments coming in, Germany, the United Kingdom, the Netherlands, and making commitments to the Global Fund. That is a good sign. The United States has also said, and is in the process of having bilateral conversations between themselves and 72 countries for their global health response. We don't know exactly what the outcomes of those conversations are. When we know that at the end of this year, we will see what resources are available to run the programs. Then it is for us, for all of us, to work with governments to see where are the biggest gaps. And my suspicion is, or our suspicion is, that the biggest gaps will be mainly in those marginalized communities. So then we will need to figure out how do we fund that. And we need to keep on calling on governments to say, AIDS is not over. We're not done yet. And an additional 3.3 million new infections, in addition to the 1.3 million infections we have every year already at the moment. We have stagnated at 1.3 million new infections every year. That is not sustainable for any of us. So we do need to continue political will amongst donor countries, but also countries that are most affected by HIV.
Christine Stegling, good to have you with us on the programme today. Thank you very much for joining us there from UNAIDS in London. Thanks very much for being with us on the programme.
Thank you so much.